Hi, my name is Anisha Black. I'm going to first review the patient's chart for any allergies and medications and the procedure and location of the wound that I'm going to assess on the patient and any special precautions that the patient may be on, isolation, and none is indicated. Next, I'm going to perform hand hygiene and make sure that I have properly performed hand hygiene. Next, I'm going to, hi, my name is Anisha. I'm going to be your nurse today. Can you identify your name and date of birth while I look at your armband, please? Thank you. Minnie Mouse, 12/6/1960. Miss Mouse, do you have any allergies to any medications, foods, or environment? Okay, no allergies. Thank you. Are you in any pain right now? On a scale of 1 to 10, 10 being the worst pain. No pain? Okay. Okay, next I'm going to be checking your wound and I'm going to clean it. I'm going to change the dressing as well. Are you okay? Okay, thank you, Miss Mouse. Next, I'm going to set up my set all of my materials. I have all of my materials in place. And next, I want to put on some clean gloves. Once I have put on some clean gloves, I want to next expose Miss Mouse and expose her wound. And it is okay. Put her in a position of comfort while I do my procedure and cover her with the bath blanket so she doesn't get cold. All right, Miss Mouse. Next, I want to put an underpad to collect any drainage while I do my procedure. And next, I want to expose the area. I'm going to remove the tape with the push and pull method, making sure to go in the direction of the skin, the hair growth on the skin, and being mindful of the patient. Once I remove the dressing, I'm going to check for any discoloration, any smell, and there's no odor, no smell, and no color to the drainage. Next, I'm going to look at the patient's wound and check for any granulation, necrosis, eschar. Make sure there's no tunneling and the color is beefy red and the skin around the wound looks healthy and it looks to be at a stage 3. And then I want to measure the wound. So I'm going to tear up my okay. So I'm going to go from the length of the wound. The length of the wound is to be about 8 centimeters. The width is about 6 centimeters. And then to measure the depth of the wound, I'm going to stick my cotton swab gently to the depth and use my finger. I got this much, and then I'm going to measure. The depth is about 2 centimeters. Once I've done that, I'm going to dispose of all of my materials and clean my hands again and perform hand hygiene. Okay, now that I've performed hand hygiene, I'm going to set up my sterile field. And to set up my sterile field, I'm going to open away from my body and not over my area. I've checked all the, turn this way, opening away from me and only touching the borders. Okay. And next I'm going to open away. Keeping this and keeping my abdominal pad. Keeping my gauze. To assemble my tray full of water for my sterile water and put this next to my patient. Get my tape ready. Once I have prepared my tape, then I want to get my sterile water, check the date on my sterile water and make sure that it's unopened. And I'm going to prepare my sterile water into okay. Next, I'm going to don my sterile gloves. Sterile gloves. Come close so you can see my sterile glove procedure. Using my non-dominant hand. And then with my dominant hand, sterile to sterile, I'm going to glove my other hand. Once my hands are gloved, grabbing and disposing of my material. Next, I am going to, with my sterile hand, I'm going to remove the tip of the syringe and expel some solution. And then I'm going to drain my patient's, and I'm going to start from the top, and I'm going to drain so that it can flow to the bottom, from top to bottom. Once I have successfully cleaned the patient's wound, I will then dirty. This is my clean and this is my sterile. I am disposing of that. And next I'm going to dry the patient's wound, top, bottom, inside. Once that is done, I will need to pack the patient's wound. So I'm going to take a piece of gauze, kind of spread it out, then stuff it in the water. Once I've successfully done that, I'm going to grab my my sterile to clean, because I'm going to need my applicator tips. Squeeze out my excess water. And I'm going to pack the patient's wound. Once I've successfully packed the patient's wound, I'm going to next cover the wound with a loose piece of gauze, and next I'm going to cover with the ABD pad. And at this point, the wound is covered, and now I am going to use my pre-lined tape to tape the patient's wound securely. Patient's wound is successfully covered and secure. And next I'm going to remove all of my excess materials, cover my patient. Thank you, Mrs. Mouse. I am done, And I'm going to clean my materials and dispose of any excess water. Remove my sterile gloves and perform hand hygiene. And I'm going to review the patient's wound at every shift. The patient's wound should be checked. And that is it.